Bismillahirrahmanirrahim. Hello everybody. So a 29-year-old woman gravida 3 para 2 comes to the emergency department due to sudden onset heavy vaginal bleeding that has soaked through her clothes. The patient has an inconsistent prenatal care and shares that she is about 8 months pregnant. She has had some non-painful contraction. 4 years ago, she had a low transfer cesarean delivery. The patient smoke a pack of cigarettes daily and take no medication. Temperature 37, blood pressure is 96/70. Pulse is 118 per minute and respiration at 16 per minute. Fetal heart monitoring show a baseline of 150 per minute. Moderate variability, acceleration, and no deceleration. Tokodinometry show irregular contraction every 10 to 15 minutes. Which of the following is the most likely diagnosis of this patient? Choice A, placenta previa. B, placenta abruption. C, preterm labor. D, uterine rupture. E, vasa previa. So first of all, this patient has heavy vaginal bleeding. This is the first hint. The second hint is that she is about 8 months pregnant. About 8 months pregnant. This is the second hint. The third hint is that she having non-painful contraction. This is the third hint. The fourth hint is they 4 years ago she having a previous cesarean delivery. And fifth hint, she smokes a pack of cigarette daily. And the sixth hint is that the fetal heart rate is above normal, is 150 per minute. So based on this hint, what is the diagnosis of this question? First, heavy vaginal bleeding. Second, she came to us about 8 months of pregnancy. Third, non-painful contraction. Fourth, previous cesarean delivery. And she smokes a pack of cigarette daily with fetal heart rate is equal to 150 per minute. So diagnosis of this question is placenta previa. Why the placenta previa is the correct one? Here the choice A is the correct one because the patient most likely has placenta previa, which occurs when the placenta covers the cervix. Risk factor include multiparity, smoking, as I explained to you, smoking, and previous cesarean delivery. This patient also has previous cesarean delivery. Placenta previa is common diagnosed in asymptomatic patient during a routine second trimester ultrasound. And patient diagnosed with placenta previa, digital cervical examination, and sexual intercourse are contraindicated. Patient with symptomatic placenta previa have painless vaginal bleeding after 20 weeks of gestation. Continued maternal blood loss can eventually lead to fetal compromise with deterioration of the fetal heart rate tracing. Management is dependent on maternal hemodynamic stability and fetal status. So I will show to you that what the placenta previa look like. So this is the placenta previa. As we see here that the placenta covering the cervical os. So this is the placenta previa. First, this is a normal pregnancy and with the placenta not covering the cervical os. And this photo, the placenta previa, the placenta is covering the cervical os. Why now we can come to the choice B. Why the choice B is the incorrect? Placenta abruption. Placenta abruption is vaginal bleeding which causes constant abdominal pain, uterine tenderness, and fetal heart rate abnormalities. Choice C, preterm labor. So preterm labor present with regular painful contraction associated with cervical dilation and bloody show. Choice D, uterine rupture. So uterine rupture classically present during labor and patient with prior cesarean delivery with sudden onset of vaginal bleeding. However, patient also have intense abdominal pain, palpable fetal part, and fetal heart rate abnormalities. I in the previous question I explained that what are the uterine rupture look like. So if you don't watch that video, go and watch that video, then you will know that what the uterine rupture is. Come to the choice E, vasa previa. So vasa previa is characterized by fetal blood vessel that overlie the internal cervical os. Patient will have painless vaginal bleeding. There is typically rapid deterioration of the fetal heart rate racing. Vasa previa, in which the fetal vessel covering the cervical os. So why the choice is the correct one, I will explain to you. That placenta previa, because this patient already having heavy vaginal bleeding. That's true through her clothes. Second, she having 8 months of pregnancy. Third, she having non-painful contraction. Four, she having previous cesarean delivery. Fifth, she smoke a pack of cigarette daily. So based on these 5 to 6 hand, the diagnosis of this question is placenta previa, and the management of placenta previa is we can go and see the patient, that either the fetus mother is hemodynamically stable or unstable. Then we will decide that how we can manage it. Thank you.